All right, you guys, welcome back to the Curated Beauty Podcast. If you're watching on YouTube, which I have video now streaming, uh, you'll see a fresh face, no makeup. I'm in my sweats because as soon as I get home from work, I like to do my skincare routine so I don't get too tired. So, pro tip number one. Also, I just had Signature Halo. That is something that we do at Beauty Culture and at Beauty Culture alone. It is this elevated, amazing Halo hybrid fractional laser by Cyton. And we add in all of the bells and whistles to not only make your recovery quicker, because if you've ever had one of these lasers, you know that you are in for some really good swelling. You may never do it again because it's just uncomfortable. It's a lot. I mean, it's even a lot for me, and I'm in the industry and I've had at this point probably 7 Halos. So yeah, maybe more, but I think I'm at about 7, lucky number 7. So this past time we added in something called Essence, which is a platelet-derived growth factor, and it is just really truly showing to be game-changing. I was a little skeptical that this one major growth factor would really do so much, but it is amazing. We're using it for a lot of different things, and it ties into even this topic that we're going to talk about today. So we are talking about something a little taboo. We're going to explore a topic that affects many men, their relationships, their confidence. Let's talk about erectile dysfunction, or ED, as I will refer to it throughout the rest of this podcast. We're going to break down why ED occurs, why it affects more than just your physical health, and how there's a lot of game-changing therapies known as the PRF shot or the P shot, and it's showing really promising results. It's so interesting to me how many people really don't even know about this concept when I talk about it, either from the female version, which that's called an O shot, which I have done a podcast on before. If you have more questions about it, just hit me up on Instagram and I can help direct you towards either that podcast or some other information. But whenever I talk about either the O shot or the P shot, people are really excited about it. And the opportunity to see something that is really, there's a solution for it. And no one talks about these taboo, well, not no one, but a lot of people shy away from putting something so intimate into their medical aesthetics practice or their wellness practice, because how do you bring it up? So I have gotten really comfortable with talking about these things, about offering a solution, and about educating our patient base and beyond on what they can do and what their options are. So let's first talk about erectile dysfunction and just understanding what happens. Erectile dysfunction is often caused by circulation issues that become more common with age, and this diminished blood flow to the penis can make achieving or maintaining an erection difficult. But it's not really just a physical issue. ED is very far-reaching. It has effects on marriages, on relationships, on families when those relationships fall apart, and many relationships face significant strain when sexual intimacy is affected. This is obviously going to lead to feelings of shame, embarrassment, isolation, frustration, and sometimes even divorce. And this can have a profound impact on mental health, the overall life satisfaction. And it's not, again, just for men. This is for their partner as well. And in many ways, first of all, the O shot, there's that for women, or just in general, when this is an issue and it is affecting the relationship, obviously there's benefits to a female to getting this, remedied, so to speak. So ED really doesn't just stay in the bedroom. It will spill over into other areas of life. And as that is affecting someone's mental state, for many men, it can really mean the loss of confidence, which can really impact their performance at work, their social lives, their enjoyment of their hobbies. And it's really easy to see how addressing this problem could restore not only this physical health and this bedroom part, but also a person's overall quality of life and a sense of worthiness and competence and all of those things. So Let's talk about some traditional ED treatments and their limitations. I have talked about before how there are so many more options for men and sexual dysfunction that they have versus women. So I'm really obviously super passionate about women's overall sexual wellness and function, but let's not leave out the coupling of how that affects a relationship. And just treating more people in general and all of those things. So when it comes to treating ED, there are options, especially for men, like I mentioned, but many come with drawbacks. So vasodilators, think of them as a quick fix pill. So a vasodilator, like I mentioned, ED, a lot of times the pathophysiology of that is a circulation issue, meaning blood vessels. And so if we're able to vasodilate those blood vessels or make them bigger and get more blood flow to the area, that is going to help with erection, maintaining erection, and sexual arousal in general, and obviously complete the picture. But vasodilators can come with a lot of side effects. They can be expensive. They don't work for everyone. And more importantly, and what I'm so passionate about is they don't actually reverse the underlying issue. They're simply dilating the blood vessel temporarily, but the root problem remains. And so does the frustration for many men. And also there's the inconvenience factor of having to take these and plan and not have that element of spontaneity that, the younger male population can have. Surgery is another option, but it is invasive. Surgery is an invasive thing, obviously, and it carries a risk of some very, subtly rare, but some pretty serious side effects. So surgery is a major step. It's not a decision to be taken lightly by patients. And so this is where this whole concept of the pre-apis shot or the P shot comes in as an exciting alternative that is minimally invasive with none of the long-term risks associated with surgery and something that can easily be repeated and is relatively inexpensive, and is pretty readily available to those who know about it. So what's new? Okay, so the science behind this neovascularization, this means we're creating new blood vessels or healthier blood vessels. What makes this P shot different? Well, the answer lies in a process called neovascularization. And like I said, this is the process of involving new blood vessels to help regenerate tissue. There was a 2003 study published in the Journal of Urology and so 2003, okay, hello, that was over 20 years ago at this point, demonstrated that using growth factors could stimulate the growth of new tissue in the corpus cavernosum, leading to bigger and stronger erections. The P shot harnesses this process by using growth factors derived from platelet-rich plasma or fibrin or whatever autologous factor, meaning it comes from your own body, we may be, using. PRP is slightly different than PRF, but essentially PRP, a lot of people have heard, it's a part of the blood that is in your own body that we spin down. There's a part of the plasma that is a portion of the blood, and then there's a part of the plasma that's called platelet-rich plasma that has a significant amount of growth factors and is a mainstream therapy that has been used for years, ranging in many different treatments. So this could be cosmetic procedures. We used to use it after things like Halo that I just had on my face because it had all of those rich growth factors, cytokines, things of that nature. And we also use this in the traditional O shot. And this is really also helpful in females for incontinence, especially for those women who have had children and are suffering from incontinence from that. So when it comes to erectile dysfunction, PRP's role is to rejuvenate the penile tissue and help restore healthy blood flow. So now let's talk about specifically the P shot or the pre-apis shot, just fully explained. So the pre-apis shot is a specific method of isolating these growth factors from a patient's own blood and injecting them directly into the penis using a very particular technique that we've been trained on, or any provider who's providing this treatment has been trained on. And what is the goal? Well, the goal is to get the growth factors right where they need to be to stimulate tissue regeneration and enhance blood flow. It's important to note that the P-Shot name is protected and trademarked. Only those who have been trained in the specific procedure can use that as branding. Anyone can use the technique. Anyone can use some slight variations of the technique. But if you're marketing the Priapus shot, you need proper training, or else the division of medicine, that business, they'll come after you. So the results really do speak for themselves. 90% of men who receive the P-Shot report an improvement in erectile or erection quality, which 90%. So that's amazing. It's currently the only therapy that has shown the ability to increase blood flow to the penis, other than, like I said, those temporary vasodilators. But this is a more natural, long-lasting, actually regenerative solution compared to pills or surgery. So let's talk about the safety and any side effects. One of the most appealing aspects of the P-Shot is its safety profile. So PRP, being derived from the patient's own blood, has a very low risk of side effects. It's been used very safely across a variety of medical fields with no known serious side effects in any other part of the body. And in fact, the worst side effect really that's been reported is occasional bruising, which typically just resolves quickly and on its own. And because PRP stimulates natural tissue repair and regeneration, repeated injections over time can actually lead to ongoing improvement, offering a cumulative benefit without the downsides of other, the other treatments might bring. So, really lastly, let's look at the big picture. Beyond just the physical benefits, restoring sexual function really means restoring a man's sense of self-worth and intimacy with their partners or partner, whatever, to each their own. And it can really repair relationships that might have suffered in silence for years. And it can make a huge difference in how someone feels about themselves, both in and out of the bedroom, because that is such an integral confidence shifter, honestly. So by addressing the root cause of erectile dysfunction with a regenerative approach like the P-Shot, we can really help men regain control of their bodies, boost their confidence, improve their overall quality of life. And for many, it's more than just a medical solution. It's a way to reconnect with their partner, their passions, and their purpose. I will mention also that there's other things that we can potentially use in place of PRP that are showing really promising results. There's advanced growth factors that are now on the market. There is also the thing that I used on my face instead of PRF or PRP was Ariessin. So we would not use Ariessin, so we would use the pure platelet-derived growth factor, or PDGF. And that is something that we have been using a little bit more off-label in O shots and now in P shots. And so this is something very exciting, very cutting edge, but also mainstream, safe, effective, and really life-changing. So if you're experiencing ED or you know someone who is, it might be worth exploring options behind just temporary fixes. The Priapus shot offers a way to treat the underlying issue safely and effectively, giving patients a chance to regain their confidence and quality of life. So reach out to a qualified provider. You can go on different websites for the O shot and the P shot. You can look those up and even search by zip code or name to find a provider that has been trained in these techniques. And so you'll easily be able to find someone. Thank you for listening to this episode of the Curated Beauty Podcast. If you found this episode helpful, don't forget to subscribe, to share with a friend, and leave a review. And remember, it is about feeling your best from the inside out. So for more information with us or to schedule a consult for a certified P-Shot provider, you can visit our website, beautyculturespa.com, or click the link in the show notes. We're really there to help take you to the first step of confidence and connection. So yes, this is all information to bring you guys lives that are where you're not only living longer, but you're living stronger and we're building confidence. So take care, and until next time.